Hi everybody, welcome. My name is Victoria Hume. It's great to be here. I'll be introducing this afternoon's session with my colleague Hayley Ewell. I'm going to be introducing Shanley Pereira and Sarah Titcher, who are going to be doing separate sessions with you. And I'll tell you a bit more about both of those in a second. So just to introduce myself, I'm the director of the Culture, Health and Wellbeing Alliance. It's a 5,000 strong membership organisation. We work across England primarily, but we have colleagues from all over the world. And the members do all sorts of things. There's a lot of individual creative practitioners. We work a lot with museums, with health and social care. So we're a really broad membership body. And Hayley's just going to say a few words about digital practice in relation to what we do. So I'll hand over to her for a second.
So hi everyone, my name's Hayley Ewell and I'm the coordinator at Schwa, and we are really keen to explore how digital meets where and how it meets culture, health and wellbeing. So last summer we started to develop a live resource on our website, which we'd love any contributions to. So if you've got any thinking around this area, we welcome that. And it was mainly a place to really start to bring together different ideas and different resources, and also like links to programs that could help people to develop their digital practice, their literacy. And we also featured a blog by an arts organisation that kind of work at the intersection of art and technology called Invisible Flock, which many people may have heard of. And their particular practice around a project called Remote Contact that worked with people in care homes, and they developed lots of different prototypes responding to some of the themes we're exploring today, where it's kind of finding different ways for people to be able to connect and to express themselves through interactive objects, but through processing digital data and lots of things. So with people that are working across the sector using digital in many very different ways. But I'll hand over to Sarah and Shanali so they can read what you mentioned in the chat.
I will just introduce Sarah. So Sarah has spent her career working across the interdisciplinary arts, academia, healthcare and technology as a producer, curator, artist and researcher. She graduated from the University of Kent with a first-class honours in anthropology with a year in Japan BSc. Following her degree, she worked with the NHS before moving into contemporary art with organisations like Fabrica Gallery and Lighthouse in Brighton. In 2016, she moved to Australia, where she worked with the School of Life and TEDx Sydney. It was here she began working in VR and joined the Big Anxiety Festival as a researcher, VR curator and awkward conversationalist. I really like that as a job description. In 2020, in California, investigating the cross-cultural sensory experience of communicating with God. She moved back to the UK and founded Hatsumi in May 2018. And as well as working with Hatsumi, she's producer on Deep, which is a meditative VR experience controlled by breathing, and is the healthcare lead for Immerse UK. So over to you, Sarah.
Oh, thank you so much for that introduction. It's kind of moments like this, you're like, oh, maybe I have been doing something in the last few years. But yeah, so we're going to do a bit of a creative exercise at the moment. So before we begin, I just want to check that everyone has just a pen and paper to hand. And if you don't, feel free to go have a quick rummage of the house. And so today we're going to be talking about this research method that I came across when I was working, in fact, with the Big Anxiety Festival. Some people may be familiar with it. It's an arts and health research method known as body mapping. And so it's an arts-based research tool which is focusing on the sort of embodied experience of pain and emotions and the connection between the two. So traditionally it involves tracing around a person's body to create a life-size outline, which is filled during a creative and reflective process where you produce an image representing different aspects of that embodied experience. It was first developed in South Africa as an art therapy method for people living with HIV and AIDS in around 2002. And I think it's a really interesting tool because it's enabling people to non-verbally communicate lived experience through drawing. And I think the reason that I became really interested in the arts and also in technology as well is thinking about different ways that we can communicate experience when sometimes there just aren't really the words to describe it, especially when you have a 10-minute consultation with a doctor and they're asking you to say what's going on, and something that completely fills your life every day, and you have this pressure to be very articulately describe what's going on. And I think that through sometimes ignoring these sort of inner realities as well of different emotions, it can really eat away at you. And I think I've had, and many of us have had probably different experiences as well, where we've tried to ignore different things that were going on underneath, and they don't disappear, they just manifest in different ways. And I think the link between things like trauma and stress and anxiety and the physical experiences as well that can lead into things like ongoing pain is really difficult. And I think when people say it's all in your head when it comes to pain and emotion, I think really belittles that experience, which is why I'm really quite fascinated by this idea of body mapping as a way of showing, not telling people that it is in your body as well as your head. So with a pen and paper, you can just like leave that in front of you or leave that aside. And what we're going to do is just start with a small mindfulness-based activity, and just get us to think about our connection with our bodies in this moment. And then what we'll do is move into a little drawing activity, and we'll finish that probably in the next 10-15 minutes or so. So it'll be quite a quick one. So if everyone could begin by just taking a deep breath and making yourself comfortable. If you're sitting in a chair, then you can allow yourself to be straight but not too stiff, and put your feet firmly on the ground as well. You're welcome to close your eyes if that's more comfortable too. You can put your hands resting gently on your lap, or if you want them hanging down by your sides as well. And just take several long, slow, deep breaths. Breathing in fully and exhaling slowly. Just in through the nose and out of the mouth. And with each breath, if you could just imagine the sense of your stomach expanding on each inhale, and relax and let go as you exhale. And begin to let go of the noises around you and shift your attention from outside of you to inside yourself. If you are distracted by the sounds in the room, simply notice this and bring focus back to your breathing. Now slowly bring your attention down to your feet. Begin observing those sensations. You might want to wriggle your toes a little bit. Feel them against your socks or shoes, if you can manage to wear socks on a day this warm. And just notice it without judgment. You might imagine sending your breath down to your feet, as if the breath is traveling through the nose to the lungs, through the abdomen, and all the way down to your feet. And then back up again through your nose and your lungs. Perhaps you didn't feel anything at all, and that's fine too. Just allow yourself to feel that sensation of not feeling anything. And when you're ready, allow your feet to dissolve in your mind's eye and move your attention up your ankles, calves, knees and thighs, and observe the sensations throughout your legs. Observe how all these sensations rise and fall and shift and change moment to moment. Notice how no sensation is permanent, but just observe how that feels in your body right now. Now I want you to expand your attention to your entire body as a whole and bring your awareness now from your legs up through your abdomen and to the top of your head, and feel the rhythm of your breath as it moves in and out of your body. And as you come to the end of this mindfulness exercise, take one full deep breath and exhale fully. And when you're ready to open your eyes and return your attention, as you become fully awake and aware, consider setting the intention that this practice of building awareness will benefit everyone else perhaps that you come in contact with today. And so when you're ready, I'd like you to think about perhaps a moment when you felt anxious recently. Perhaps you got some difficult news, or someone gave you some sort of surprising information, or you've been worried. And what I'd like to invite you to do is make a little outline of your body, nothing particularly impressive. I just did something like this. And think back to what that moment was like, and perhaps what it looked like in your body as well. And compared to perhaps the sensations that you have now, what did it feel like in your body back then? Did you feel a tightness in your throat, or perhaps in your chest? Did you feel it in your hands or your face? Does it feel like it's just inside your body, or do you feel surrounded by something? And depending on what sort of colours or pens you have available, you can also think about, beyond colours, what sort of textures it might look like. Was it a swirling sensation? Was it spiky? And what we'll do for the next few moments is just draw on a piece of paper what that looks like. There is no pressure or to show that to anyone else, by the way. Yeah, we'll just spend the next few moments thinking about what that looks like. And we'll carry on till just after 20 past. I'm getting a sense that perhaps people are coming to an end, perhaps. And so I think just recalling difficult experiences like that, perhaps it wasn't very specific, or maybe it was a specific moment, can be a little bit challenging, and sometimes it can feel like revisiting it again can bring along some physical experiences. I think that's very individual to everyone. But perhaps if we would just take a few more deep breaths and just imagine if that is something that's come back to you, just imagining with each breath that sort of becoming a more distant thing. And I know these images can also often be quite personal to people, and so I invite anyone that does have any thoughts on this exercise, or perhaps would like to talk about or share their illustration, you're very welcome to, but obviously no pressure at all. And so some of the questions could be, why did you choose to use those specific lines or images? And perhaps like why does that color or texture feel relevant to you, perhaps? I did mine very quickly, so I might start by just sort of sharing mine, and could definitely do far more. But I think that the kind of thing that I always notice when people talk about their own body maps is, and this is like very, very scribbly, is at least for things like anxiety, it's often like very stomach focused. And I think that a lot of us often sort of feel that kind of sick to your stomach, almost like swirling experience. When I get nervous or anxious, I also get I go very, very red. I'm kind of surprised I haven't actually gone red from doing this today, but usually I quite notice it. My face going very red, but also this kind of rash that appears across my chest, and I get this real sort of like tightness in my throat, and sometimes find it hard to even like say the words in the first place, and feel this sort of like weight in my head, which I think I started to illustrate as well, and start to lose this like connection between, at least for me, the sense of the boundaries of my body and what the world, I guess, sort of looks like on the outside. I remember the first time I ever got in like very severe trouble at school, and I remember feeling like my legs were like waves that were just sort of wobbling, and like the floor underneath me was moving, and that whole sort of connection to what I thought was an objective reality sort of really transformed, I guess. But every moment, I guess, and every different experience like this can be very different. I don't know if there's at this point anything anyone else wants to add. Absolutely fine if not.
If anybody does want to ask a question of Sarah or add anything, you could raise your hand in the participants section of the screen, or you can just yell at me. No yelling, so that's something.
That's fine. I guess just to add towards the end of this, yeah, always feel free to put any questions in the comments below, but just to sort of expand on, I guess, what I've been doing now with body mapping is I'm beginning to translate this into a virtual reality experience. And so thinking about how using something like virtual reality could potentially enhance the capabilities of body mapping. And so we're developing an experience that you start by doing this mindfulness-based experience, and you are embodied in a 3D avatar that's almost like a ghost-like outline of a body that scales to your own height and dimensions. And then as you finish the mindfulness exercise, then you can physically step out of that body as if you are yourself almost having an out-of-body experience. And then that becomes the canvas on which you can draw on. and we are creating animated 3D drawing tools, and we're looking specifically at how this can be applied to supporting people with chronic pain. And so we're co-designing 3D drawing tools with people with lived experience of chronic pain. We're actually just recruiting some people for that workshop as well. We get paid £30 per session, and so I'll drop that link in the tab as well. But we're really interested in how you can use things like 3D drawing and also sound as well. So we're starting to develop different sounds that you could paint spatially on the body as well, to illustrate what that experience is like for you. And we're interested in, going to start bringing this into waiting rooms in hospitals. We're hoping to start a trial with a hospital here in Brighton by the end of the year, working with paediatric patients to see if that can actually improve the communication between a patient and a doctor, and if they can get a more accurate understanding of a patient's experience by starting by having this illustration that they can bring into a consultation room, and see if people do feel better understood, or if there are different ways of being able to communicate that experience through art making. Do you have a question, Shana?
Yeah, just to share what I don't know whether you could see it, but when you were talking about it, it's not white background, so you might not be able to see it properly, but it was almost like swirls of I felt currents going through my hands and legs during that time. So I was just trying to demonstrate that, not very well from on this, but that's what it was like for me. And you said about stomach, mine was in the brain. So it was almost experiencing that the same feeling you were describing in the stomach, but in the brain. So just wanted to quickly share that. Thank you.
Yeah, that's really interesting. And I guess, yeah, these experiences are just different for everyone. And I guess it's so different on the situation. If it's something that perhaps is like mentally stressful as well, there can be that sense of, yeah, that sounds really cool.
Can I ask a question, Sarah?
Oh, please do.
Right. I'm just quite interested in this new project that you're doing, and particularly the use of sound as well. And in my other role, I've worked with somebody who's got synesthesia, so he sees colours with sound, and he's very much into virtual reality, and he's been using it for his own kind of depression, anxiety. So I'm just kind of interested, are you exploring that, the way that people might process or experience things in that way as well, or is it just for chronic pain?
That is something that I'm super interested in, and actually been working with the president of the Synesthesia Association to explore this as well. He's a really amazing artist called James Wannerton, and yeah, we've been looking at what those applications could be together as well. He has a really unique form of synesthesia called lexical gustatory synesthesia, which means that he tastes colour. Wow. And also personalities as well. And so apparently everyone comes with their own unique flavour. I think he told Philip Schofield that he tastes like orange pith. Yeah, but I think that, yeah, the world of synesthesia is something that I'm very intrigued by, because actually the current ways to diagnose synesthesia is that you have, I don't know if you're familiar with this, but you are given the alphabet, and then you have to assign a certain colour to each letter in the alphabet, and then you have to do it again, and they basically see how consistent you are in that reporting. But I think speaking to people with synesthesia, it's not just that they associate certain colours with letters, for example. It's very much like related to the body. Well, and that it's certain areas that they feel these sensations. And one of the most common forms is called time-space synesthesia, which is most people like actually much more experienced than people believe, which is the idea that we experience time as something that we experience around the body. So for many people, it's like the year is physically moving around them. So I'm really interested in the future about looking at how body mapping could help understand all these like different sensory experiences, because there are so many different types, be it, yeah, people that have quite extraordinary experiences like that, pain, psychosis, like emotions, but also really like beautiful things as well. I remember one of the first people that tried the body mapping VR experience drew what it felt like telling their partner that they loved them for the first time. And I just thought that was really powerful. And it's really interesting because especially in VR, because you're given all of this space that's not just in the body, then people tend to draw outside of themselves much more. So with him, then he kind of drew this kind of huge bubble coming out of him and almost wanting to absorb this other person. And somebody else with body dysmorphia, they drew like feelings of happiness and then their experience of body dysmorphia. And it's really interesting seeing them side by side, because their sort of experiences of happiness, they kind of draw as totally external to their body, rather than when they drew their dysmorphia, it was very stomach focused. They'd like scribbled out their face. And then the only things outside of their body were these red arrows. And they talked about this feeling of just constantly being watched. And so thinking about how can we start to use these visualizations as a way of perhaps changing them and exploring how we might be able to change our relationship with our inner landscape, I find really fascinating.
It's fascinating.
Which is a perfect segue, actually, I think, to what Shanley's going to be talking about. That I think that idea of how what we externalize can create change is really interesting. And there are other areas in arts and health, obviously, that look at that, including forum theatre and a lot of applied drama. Anyway, I'll come back to that later, perhaps. So I'm going to hand over now to Shanley. I'll just introduce her quickly. Shanley is the founder of Changing Lanes. She's a digital artist, an educator, a retired clinician, and a patient. She founded Changing Lanes, as I said. She works across the intersections of art, health, medical education, patient support. She took up digital art following early retirement because of a rare illness that came on during her specialist training in rheumatology. And she explores art and the human factor, using colour as a method to document her observations and portray different energies surrounding the essence of being a patient. Her digital canvases, as I think she'll explain further, are her interpretation as an artist, patient and clinician of what pain looks like. Just before Shanley starts, just to say, if you have any further questions for Sarah or any for Shanley, sorry, I mispronounced your name again. I've known Shanley for 2 years and I'm still getting this wrong. Very embarrassing. So if you could put any questions into the chat box and then we can pick them up later, and there will be a bit of a chance for a discussion after Shanley's finished. Okay, over to you. Thanks.
Thanks, Victoria. I nearly didn't unmute myself but was going to start talking. Sarah, that was brilliant. So I'm going to come at this in a slightly different angle by sharing my personal experience of using color to capture the invisible. I'm treated, as Victoria said, I'm treated for a rare condition called vasculitis that affects my hand function and mobility, amongst other things. And I've been using a digital app to create art to sort of cope with pain, the illness experience, and everything else, all the changes that came with it. So by giving you a snapshot of my journey using art to sort of transform my illness experience into a more meaningful way of living, moving from a clinician to a patient, I hope I can give you an overview of self-expression and illness. Please bear with me. I'm supposed to share my screen at this point. Yeah, there we go. Yep. Okay. Okay. So before I move on, can I ask you to describe your life journey in one word? Now, I know this is going to be hard, but if you please have a go at it, we will pick up on it a bit later on. But if you can use your chat box to type in one word to describe your whole life journey so far. And I'll tell you why I've asked you this question as well. Okay. So starting with the concept of my work, it is to try and capture and represent my personal experience, but of using color as a method to document my observations and portray all the different energies surrounding my day-to-day living with the illness in an attempt to objectify what is subjective. Okay, so illness is the subjective component that describes the patient's experience of disease. equally pain, change, these are all subjective. So our individual experience and perception of it, how we connect with it inwardly and outwardly, varies. So my own relationship with the whole illness, pain, change as a concept and process, how it makes me feel and act, prompted me to explore this further with my art. So my digital canvases shows my take on how it looks like and feels like as a bodily experience, the whole visual capture of all these embodied feelings illustrated within the body. Given that so much of the human experience around illness is steeped in emotion and complexity, the focus of my art is on our understanding of identity, art, illness, how it feels to express it, make sense of it, as well as giving it more visibility and a voice to bring out the human aspect of illness. And unlocking the power of color to communicate what goes on in my invisible world. So I've been using different colors to try and capture different emotions, variations in pain, and the different color fields or the changes in my color fields and the concentric lines. Can't get the cursor to it. So yeah, so these concentric lines and sort of different color hues, they represent complexity, change, and the whole posturing of the body tries to capture the embodied feelings, and positioning of bodies, which you will see later on, again tries to show connection, communication, etc. And the whole composition tries to represent the overall endurance and resilience with illness. Next, moving on to how art can be a powerful tool to reveal the physical, emotional, social, spiritual impact from illness. This drawing illustrates in a turmoil, literally, how the illness dominated and distorted my image and identity and who I was as a person, being subjected to all sorts of social expectations and pressures, feeling really vulnerable and isolated, even being surrounded by different people. And also, this is trying to show all the challenges that I had to go through. The start of my illness was during my specialist training in rheumatology, and I was subspecializing in the condition that I got. So it was truly quite humbling to become a patient in your own specialty. So it was bad enough becoming a patient, but dealing with all these multiple layers at once and losing power and control, and I sort of lost total control and the direction my life was heading when I had to give up my career. I just felt robbed of all my dreams, expectations, and this is what my everyday brain looked like, trying to cope and combat with so many challenges despite pain, fatigue, etc. And this is just to show you what pain looks like to me, coping with the whole experience looks like, and trying to work around my limitations and connect with other people despite everything that's going on. And finally, just to kind of illustrate all the interconnections that you have to make with health teams, with your friends, family, while you are revising priorities and readjusting and accepting change, etc. So, this is the hard work of being a patient. And of course, this whole experience redefined or helped me to redefine a newer version of me, almost emotional self-regulation, to walk past old expectations and standards that my pre-ill self had set for me, and reshape a newer version of me, not dominated by illness. It's not shanily is not just the illness. Shanali is a person as well. And to use art to find meaning to what I'm going through, purpose in sharing it with others, and to somewhat cope with the whole illness experience is empowering. But it is certainly empowering to have self-directed creations when the illness is constantly trying to disempower me. So hope I have given you some idea about self-expression and visualizing the invisible. I'm going to pause for a second and see whether I have got any answers from the exercise. Okay, so I've got adventure, realization. Great stuff. That's great, thank you. The reason why I asked you to try and come up with one word is just to highlight sometimes it's very, very difficult to put chunks of experience and sum it up, to sort of look at chunks of experience and sum it up. So as a person, as a patient, sometimes it's very, very hard to verbalize things, especially as Sarah said, you've got 10 minutes, in a consultation. So expressions of illness, those hard to verbalize aspects, using art forms can certainly help clinicians get a deeper understanding of what people go through, the impact illnesses can have on image and identity, but also it can help others around you perhaps get a better idea about what your everyday looks like, and change existing attitudes and challenge stereotypes and stigma around illness. Okay, now coming to another exercise, given what I have said so far, would visually accepting pain or change make a difference to the person who is describing it, as well as the person who is viewing it or observing it, or listening to the person who's describing it? So can I please ask you, when you think of pain or change, what color comes to your mind and what shape comes to your mind? I'm going to ask you to unmute yourselves or use the chat box at this point. I'm not sure how we're doing for time. Victoria, do we have?
A couple of minutes, I think, would be okay, Shanali.
Okay, great. So yeah, if I can get you all to have a think of whether there's a color or a shape that comes to your mind when you think of pain or change.
Hello, Shani. Can you hear me?
Yes, I can hear you.
So this is Amano Inai speaking. I'm one of the artists who had their work featured on the gallery today, or for this conference. So mine was the catharsis one. Initially, in answering your question, when I think of pain, I think of like a black ball that's inside, mostly in my stomach, and it's like it's kind of very limiting, and it's in a sense like it holds you down and keeps you from moving with the flow. I've also noticed in when I'm trying to create my art that when I'm trying to interpret my emotions, especially anxiety, I noticed it's felt like a force field has been around me. Like when I'm wanting my mind to move and my body to move, but it's like it's stagnant or something's holding me back or pushing me back from actually getting tasks done. So when you think of a color, I will either say black or dark blue, if that makes sense.
No, totally does. Thank you. Thank you very much for sharing that, because then moving on to my last slide, it was literally to put this out there to you, because given everything I have said and shared with you, and what how we said how it's hard to sometimes describe things, would giving a shape and a form, just like what you described, make it easier for the person who is listening to you to understand what you're going through, because pain is something, or change is something that is very subjective. So if the other person hasn't really gone through that, they perhaps wouldn't understand the severity or what you are trying to say. So giving it a shape and form, would that make a change, or would that allow the other person to see it in a different light, see it in a different angle, and perhaps understand it better? And what I'm trying to come at is, would it add a sensory dimension to the patient-physician dialogue? You know, would it make an impact in health communication? So I'm putting it out there to you guys to sort of share your thoughts on this.
Would anyone like to come in on that? I mean, certainly for me, I think it does give us a bit of a window into another person's experience to have that sort of visualization. But what does anyone else think? Do feel free to jump in or put your hand up in the participant box or say something in the chat.
Yeah, I'd just like to jump in again. I would say yes, and absolutely yes to actually sharing. Well, visualization will help with the conversation. As I said, like doing my exhibition, one of the pieces I did was called Rage, and I drew like 3 blue wolves surrounding me to signify how anger can create an aura around you, but it can also constantly affect you as well, and it can actually lead to physical ailments as well, like headaches and stress, etc. And what I noticed as the feedback from my exhibition was that the emotions that people were feeling, it actually helped them visualize what they was feeling actually, and it actually gave them a point of reference to something that they had experienced but never was able to articulate. So now, like, and that was the whole point of my exhibition, was to say, like, you know, these emotions that we feel are universally felt but individually experienced. And so there was like, yeah, I will use or purchase one of your art pieces. So like, anytime I feel this way, I can use this as something to explain to another person. So
certainly, great. No, thanks for that. And that's exactly what I was also trying to. One of the points was, it's the person going through it. When you put a color and shape or objectify it, literally, it helps you, the person going through it, as well as the person, I think, who's observing it. And I think that's what, and that totally makes sense to me. And I hope that makes sense to, I can see Sarah nodding, so hopefully.
Grace has made a very interesting point in the chat about, you know, this depending on, it's a two-way street between a clinician and a patient, and wondering if some clinicians are more geared toward visual learning, as some are geared toward visual expression. I don't know what you both feel about. I suppose in this session we've been favouring the visual in the creative realm, but do you think it has to just be visual? What are your thoughts on that?
No, I think, as Sarah mentioned, sound, you know, I think, you know, when I think adding other dimensions, when we say sensory dimensions, it's not just visual, it could be sound, it could be, you know, anything else, I think. But that's a great point. Not everyone's got abstract thinking, or, you know, in terms of, you know, when it comes to clinical practice. I think, talking from personal experience, we're more taught to be doing things in a robotic way. So when you see the patient, you know, you're trying to, you know, tick box, okay, make sure that, you know, all the symptoms are under control, you know, no side effects, things are stable. If they're not, you investigate. So it's during that scenario, not everyone's going to be very open to seeing things slightly differently or taking on board what we are, you know, talking about. But I think there is a lot of room to plant a seed in people's minds, especially clinicians in training, junior doctors and medical students. You know, planting this early in their career can certainly make them more open to seeing things. And I know there are some practices that use certain cards so that patients can show, you know, different pain levels, etc. So some pain clinics are already doing that. So I think I think it's an area that we could explore further.
Sarah, do you want to add anything to it?
Yeah, absolutely. I think that the one thing that I wanted to add is just that I think within those consultations, it can be quite paralyzing when suddenly you just have this moment to almost pitch your problem. And I think what I've always really enjoyed about the arts is it's a bit like when you have a conversation when you're in a car with somebody and you're not looking directly in somebody's eyes, but you're kind of staring at the road in front of you. And I think it invites this very different conversation. And if there is something that you can almost use as a catalyst to that conversation, and I guess that's what art therapy anyway can often be like. You're not having to directly put it into words when you don't really know how you feel, but also perhaps there's creating an opportunity beforehand to get people to really think about what is going on, because often we're all really busy and we're like, oh, I've got a doctor's appointment and I've got like 20 meetings beforehand, and then you get there and they're like, what's up? And I'm like, oh god, I don't even remember anymore because I've got like 50 things going on in my head, but it's like it's roughly this thing. And I think there has already been some early evidence. I'll paste in the chat in a second an interesting piece of research around digital pain drawings to improve doctors' understanding of acute pain. And I think that was a bit more of a sort of marking onto a digital body to explore. But what I really enjoy about the creative arts is actually just giving people a variety of tools. And I think that's what we're really looking into with the body mapping work that we're doing at the moment, is if you do digitize something, are you actually limiting people's choices and putting words into their mouths? And I think with sort of normal pen and paper, you can have almost like limitless options, and whilst digitizing can also create a lot of new opportunities to understand and save and analyze in different ways. I think that you have to be really careful about the tools that you're creating, especially when perhaps we all come from a very certain perspective. And I think that cross-cultural approaches to how we represent pain is really interesting, because I think here it's really classic to go for like red is pain, but in places like China where that red is luck, then that would be very different. And that's what we sort of found with the research at Stanford that was exploring the sensory experience of communicating with God. It was actually looking at how that manifested around the world, and they found, for example, in places like Africa, people had more auditory experiences compared to places like Thailand, that it was more visual. So I think through being able to digitize these experiences, there's also new ways of being able to explore and understand this variation as well.
Thanks, Sarah. Shanley, did you want to say something? Go for it.
One quick question in terms of people who are colorblind. You know, I've been recently thinking about or trying to look into this in terms of their interpretation of pain and color, and exactly well, it's going back on the point that Sarah said about cultural interpretation of pain. People using red as in different cultures, with their interpretation of that color would be different. I wonder how people who are colorblind might, in terms of interpret something, if we show them a piece of art or give them a color chart to describe what pain level they're going through, whether that would have an impact. I don't know whether you have any thoughts on that.
I wonder if it goes back to Grace's point about, this being such an individual situation, and colour may not be a mode of expression for many people for many different reasons, I imagine. I was thinking when you were speaking just now, Sarah, about that thing being in a car and, your focus is slightly divided, so you're able to be slightly more free in the way that you speak. I was at a presentation recently a colleague was giving about using traditional storytelling as a mode of working with bereaved children. This is in a South African context, and she was talking about the ways in which the fantastical elements of the stories provide a kind of distance which allows the kids to approach the problem in a manageable way, which I think kind of connects to what you're saying. It's in a way the medium is less important than the process of externalizing and distancing. And Jagriti was making a similar point, a connected point, I think, about she's describing in the chat, forgive me if it's if Jagriti is he, sorry, describing making a maze puzzle with different colours that change in intensity of colour. It makes me feel stuck, like my problem, but it also pushes to the solution. There is a kind of tension between, you referred to the difficulty of doing these kind of exercises, Sarah, at the beginning, that, you know, putting yourself in an uncomfortable place, and can that push you toward a different way of processing the experience?
Yeah, and I think trying to make it a playful place, or something that is compelling or inviting, makes people perhaps more open to it. Like, lots of the work I do is about virtual reality, which is ultimately a gaming medium, and I think it's quite interesting that people want to play these things and are intrigued, but how do you have like a sort of deeper message or process behind that seems just playful and enticing to begin with, but actually yeah, can be something very different. I know that Becky's working with someone called Dr. Jessica Stone as well, that created something called the virtual sand tray, which is a tool for play therapy. This is really embarrassing. Someone's just knocked on my door, so I'm going to have to run for a second. I've just
realised that we're out of time. So
knocking on your door, Sarah.
Thank you so much, everybody. I'm sorry to bring this to a slightly abrupt end, but a big thank you to Becky for sorting this all out in the background and keeping us going. And thank you to my colleague Hayley, to Shanley, and to Sarah in her absence. And yeah, thank you for all your input into the chat and the conversation. It was really fascinating.